For example, it can be said that there is a relationship where if you increase the milliampere or increase the kV, kilovolt, you can reduce the scan time. This is because you are providing a large quantity of X-rays in a short time, similar to giving a low milliampere over a long time. However, what is the drawback or disadvantage of increasing the exposure time? In this case, the patient might move, causing a blurring effect or an unsharpness effect. So, when you increase the focal spot, you can provide a high milliampere, allowing you to reduce your time. By reducing your time, the patient is less likely to move, which improves the efficiency of your imaging. Let's look here. As I told you, I have a source of X-ray and there are two objects here that seem to have a shadow exactly. There are two objects here, and it seems like they have a shadow exactly. Well, if you could see them, there was a very different quality you could observe. You could distinguish between them. You could see them, 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 you could see them. Interact here, and here it comes from this area. Interact here, and that's it. So, you have an overlap in this area, which consequently does what? It reduces what is present. This is a flaw when you increase it, and that's why they always tell you what? We use it with things that need it. If I were to ask you, do you think you would prefer a small focal spot or a large one? Small? Why? Because I need resolution. Now I understand. I have grasped the focal spot size. When it is small, I will face a problem. With the focal spot size here, what is the problem I will encounter? Tube rating. It told me, may God bless you. Tube rating is the issue we are discussing. So how do you formulate my equation so that my actual focal spot size is not too large? This is to address the problem of tube heating while simultaneously achieving an effective small focal spot size. This means keeping the actual area where bombardment occurs between the electrons and the large anode small, but the effective one that comes out is minimal. How? Through the angling I am doing. Therefore, you can choose the anode differently depending on the model you are working with. You find the mammography small when you enter the anode angle. You have a range from 7 to 20 degrees, and you find even 10 degrees in the mammography range. You might find someone saying, up to 10, I'm working like this. More than that, you are entering the X-ray modalities. For example, why is the anode angle more than 12? Why? Because at that time, you do not need the same resolution as what? As mammography. So, mammography is considered one of the things that require high resolution. Now let's continue to understand together. The tube rating is different from tube rating. I also don't say, Dr. Tube rating, as I say, what is the allowed higher milliampere? When I say a high tube rating, it means I can provide how many milliampere is allowed. For example, when I say the heat capacity of the anode can withstand high temperatures, I have thus increased the tube rating. If my actual focal spot is large, it's as if I am increasing the tube rating, meaning I can provide high MA. I can increase my parameters. Why? Because my actual focal spot is large. Thus, my heat distribution will be better. So, ultimately, I won't face the problem of the heating effect, because I reduce the heating effect by adjusting the heat capacity. Heat capacity means the thermal energy that I can withstand. I can withstand a certain temperature. Is that clear, doctor? So, it's like they are opposites. The tube rating is the opposite of heating. Yes, they are like opposites. All right. As we will see in a little while, I will show you the tube rating chart. When I say tube rating, it's as if I'm talking about the allowable milliampere. This way, I can set the limit. When I increase the source, it's as if I have increased it, resulting in a loss in special resolution. So I cannot discriminate between the two objects. So, what is this solution we are talking about now? The align focus principle is the solution that allows for tilting or angulation of the source line. Now, see what happened here when I applied this angulation. There was discrimination between the two objects in my shadows, which increased the special resolution. Why? Because with the same actual focal spot, you improved or reduced the effective focal spot. The effective focal spot is the projected one, which is the projection that comes from the actual focal spot. So when you reduce the effective focal spot, you increase the resolution. The focal spot has increased the resolution. So the effective focal spot here is talking about what? It's talking about when you reduce the size, but there's a problem that arises. What is the area that you can work with? Will it shrink or expand? When you reduce it, it will shrink. So when I did the angulation and increased the angle, the actual focal spot, if I keep it, remains the same. Therefore, my effective focal spot has decreased, and the coverage area or the scan coverage area has also decreased, while the resolution has increased. Now let's see what happens if I go back again. This is the focal area or the focal region, and the comparison represents the actual focal spot area. Let's see what will happen. This is the optimal focal area, which is the projection or the projection coming from the actual focal spot or from my focal spot. And here is the effective focal spot, which is the second color, or from my focal spot. And this is the effective focal spot again, again, again. Strange colors. You might know more than this. The size here is smaller for the focal spot effect than the other one due to the angling that occurred. So it's as if you focused your beam better, improving the resolution to a point where if you increase the angling, you can see this line. That's why I called it the line focus principle, because you can reach this line in your resolution, which is why it's named the line focus principle. When I talk about my focal spot size increasing and the anode angulation or anode angle causing my focal spot size to grow, it allows for an increase in MA, which is what I'm discussing regarding the top rating. This allows you to increase your MA without any problem because the anode can handle it and you can reduce the exposure time. However, a problem will arise. What is the problem? It will reduce the special resolution due to the number we were discussing, as we saw with the two shadows. Now, should this be a problem? Should this be a problem with angulation? Because it will reduce the effective focal spot size. It will decrease the 50 focal spot size and restore the part of special resolution that was lost due to the increase in focal spot size, compensating for it with the part from angulation. I think this segment will be understood because I searched for this video until I found it, which explains the relationship between focal spot size and effective focal spot size, and their relation to actual focal spot size and effective focal spot size. But this depends on the coverage of the area, of course. That's why I discuss this topic, right, Dr. Honey? I resort to this topic in cases that require high resolution. For example, when you are dealing with dental imaging, you might need high resolution or not. If you need it, you set it to on, and your exposure time is very short, so you don't overload the mammography tube. You work with low kV or high kV, but you work with low kV. So you set it to on, and here you have a low tube loading, which means your tube can handle this. Your focal spot size is small. around 0.1, 0.3 mm, which allows you to achieve resolution. Therefore, your coverage area is not large. You don't need a large coverage area. Okay, when do you increase it? You increase the focal spot size if you want to cover a larger area. You will need to increase the effect in your focal spot size more significantly to cover the area. In this case, for example, when you are working with CT, you will find that it is normal for the focal spot size of CT to be larger than that of X-ray and larger than that of mammography and dental imaging. This is because if you use the same focal spot size as that of mammography, X-ray, and dental, the tube would not be able to handle it. At the same time, you do not want the same resolution as mammography. This is the idea or the concept of the difference in what? Focal spot size. When you refer to focal spot size, you mean the effect, not the actual size, right? What do I mean? If I am talking about the tube, I am discussing tube loading or heat capacity. So the actual focal spot size and effective focal spot size are related to each other, doctor. As I mentioned, when you increase your angulation, you are increasing the actual focal spot size. Let me show you here to make it clear. Okay, I will answer you, but I want to say something before I respond. There is something called two films, right? So now the best option for me. Most devices have something called short filament and long filament, meaning short filament and long filament. If my filament is short, then my actual focal spot will be small. Now, if I increase my filament and make it long, my actual focal spot will increase. What will happen to it? It will get larger, right? This is a very important parameter because the effective focal spot here is different from here. When I increased the effective focal spot, I consequently increased the effective focal spot size by increasing the filament length. This parameter affects the increase in filament length, which increases the actual focal spot size and at the same time increases the effective focal spot size. The process of optimization is to choose the appropriate filament size for the type of modality you are working on. This is the trick or the game. To choose, as I mentioned, how small you want your effective focal spot to be compared to the actual one. For example, in cases of high resolution, such as in mammography. So, for example, you choose a specific filament size that is large and adjust the angle in a certain way to give you a small effective focal spot size that helps you. In this case, for instance, if I am thinking about a mammography device, I would choose a filament with a specific size. This filament will give me a reasonable actual focal spot size, right? So that I can have a tube that allows me to increase the degree or have a high milliampere or high parameters. And at the same time, my anode angle will give me the focal or effective focal spot size that provides high resolution. Hopefully, I didn't confuse your number. Here I have three examples. For example, such as A, B, C. In the first example, I have a short filament, and here I have a long filament. The same applies repeatedly with long filaments. Now, with regard to the anode, what happens when I change the anode angle? The actual focal spot size here will increase. It will not decrease, in fact. So, what will happen to the effective focal spot size? It will be larger, not smaller. Why? Because you have chosen a long filament here, and as a result, this will indeed be the case. Now, if you reduce it, what have you done? You have chosen the same, but essentially, the only change you made is that you reduced it. The actual focal spot size here will decrease, but the reduction that occurs will be similar to the reduction that happened between the effective focal spot size in PNC. This means that the same reduction will occur, but the angulation will still provide a significant factor for the actual focal spot size. So when you say that when I reduced the anode angle, did the actual focal spot size not decrease? No, it did decrease, but the reduction that occurred is not equal to the reduction that happened in the effective focal spot size. The effective focal spot size was very large, and now it has become small, resulting in small field coverage and a small effective focal spot. However, at the same time, it provided you with good power loading, meaning it allowed you to handle high parameters. Why? Because you still have the anode. You are creating an indolence, so the actual focal spot size is also considered larger than the effective focal spot size. So what do I understand now? I understand that when I reduced the anode angle, my effective focal spot size decreased, right? My actual focal spot size decreased, but the power loading remains unchanged because the customization that occurred in the actual focal spot size is not significant in this case. The resolution is supposed to improve and increase, allowing you to achieve better resolution without overloading the anode or the tube. The idea is not to overload your anode or your tube.
Doctor, are you with me? But doctor, you just said that when we decrease the L angle, we should increase the angle and the tube loading is supposed to improve. Why is it now called L angle and L angle? It's similar to power loading. Here is the L angle.
Here is why is there good here? And why is there good here? That's a very nice question. Does anyone have an answer to this question? The doctor says, you mentioned that when the L angle decreases, the power loading should improve. I'm sorry, the power loading should improve with the L angle. All right, why is it that both have good power loading? Do you know why? Yes, this is Mr. Bamo regarding what I mentioned earlier about a parameter that significantly affects tube loading or power loading, called filament size. The filament size here is the same as the filament size here. Is it a long or short filament size? This is a long filament size, which provides better distribution for the actual focal spot size or the heat that will reach the production on the surface of the anode. Therefore, in both cases, there is good power load here. You want to understand where the drop in resolution occurs. So, where does this drop happen? How much is the resolution? The reason is that the effective focal size is large. How can you improve resolution by reducing the L angle? When I reduced the L angle, it gave me a small effective focal spot size, but the only drawback is small field coverage. I cannot cover a large area.
I'm sorry. This part is confusing, but it's important. I don't know if I should address it in the context of the L angle or if there's a problem. A question for you, Fatih. If the MCQ says that if I reduce the power above the effective focal spot size, does it only reduce the resolution? Or does it also affect tube loading? It reduces both, right? Because the device in the MCQ plays with this note. I understand. That's why I'm focusing on it a bit to make sure it's understood correctly.
And it always brings up the part about power loading or tube loading, and this part is always related to what you need to do if you want to increase the power loading. This means that if you want to increase the power loading, you will increase the L angle. If you have a problem with resistance and you use resistance, the effective focal spot size will come to mind. The smaller it gets, the better the resistance. If you use power loading, the effective focal spot size will come to mind. The larger it gets, or you choose a long filament or a short filament, the L angle will become larger. But there are two things: tube loading and resolution. That's why today's machines have two filaments, giving you the option to choose between a short filament and a long filament. The short filament, for example, is used for things that require high resolution. Anything needed, anything. I need 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 anything. Normally, if I think like I want something like this, then I would choose a short filament in something I need. It gives you the option to choose what you want, right? So, what is the drawback of using a short filament? Do you think the power loading here will allow the anode to handle high parameters? Will it withstand high power? Of course not. But it does provide you with a small effective focal spot, which is a better focal position. Why? Because consequently, when the filament length decreases, the actual focal spot also decreases, and thus the projection or the effective focal spot size becomes small, right, doctors? This is the point where the effect on the effective focal spot size also becomes small. Mom, do you see this note? This note is about the relationship between the actual focal spot size, the filament size, and the effective focal spot size. Choose which one here, and you will find it in front of you. I just hope this part is completely understood, so that it doesn't get a bit confusing.
Regarding large field coverage, it is not related to filament size because first, the filament size was small and the field coverage was large if, for example, the anode angle was large. Also, when the filament size was large with a large anode angle, the field coverage was also large. This means it is not related to filament size. So the image you provided is very difficult to interpret in this context. A and B had large field coverage, even though one was small at A and large at B. We can say that field coverage is only related to the anode angle, not the filament size. Your field coverage is dependent on the anode angle. Keep in mind that the point you mentioned is a good one.
The focal spot area is essentially the area where the highest resolution point is located, which is the center of the X-ray beam. What does this mean? It means that there are X-rays present in this entire area, but I am talking about the highest resolution. When you center the patient and start imaging, do you place them on the edges of the beam or do you place them in the center? You position the laser so that the patient or the organ, which is the scanned organ, is in the center for me. So I have X-rays here, and I have X-rays here as well, and I have X-rays here, and I have X-rays here too. This is mainly dependent on the anode angle. The part that the doctor mentioned is important because it relates to the anode angle. In cases where we reduce the angle, we reduce the field coverage. However, here, when we reduce the small angle, we reduce the small field coverage. The problem is that the small effective focal spot size resulting from changing the filament size will lead to issues with tube loading. The problem lies in the tube rating. As I mentioned to you, the process of selection or choosing the most suitable tube or anode angle, along with the appropriate filament size, will help address the tube loading issue while simultaneously resolving the resolution problem.